Yarn World. I am so excited to be here today. My name is Jordan Deschambre, and I am the Director of Marketing at Aesthetics 360 in the historic 3rd Ward. And I am here today spilling the tea with my friend Erin, who is the lead clinical esthetician here at Aesthetics 360.
Hey Jordan, hey everybody.
Yay! And what are we going to talk about today, Erin?
Well, we are spilling the tea on microneedling.
Yes, we are. And I'm really excited about this because this is something I have always wanted to try.
Absolutely.
I don't know a lot about. I've only been here for a couple weeks, so I'm still learning. So this is a really great educational opportunity for me as well, and for all of our viewers right now. So microneedling, what is it in a nutshell?
So microneedling, there's a lot of buzz around microneedling, and there is this kind of, oh, does it hurt? What does it really do? So microneedling is a treatment that uses this device here, this is our skin pen, where we're creating a controlled injury on the skin with micro needles.
Okay.
Now, with that controlled injury comes an amazing amount of collagen induction. When we have more collagen in our skin, that underlying support, we notice less fine lines and wrinkles, less visible acne scarring, less visible hyperpigmentation, texture. I mean, I could go on and on and on.
Yeah,
really.
there's a lot of benefits.
Tons.
Now, for a procedure like this, are there some people who are better candidates than others, or is this something that anyone could have done?
You know, we always want to do that physical assessment. Absolutely. You know, I would say this treatment is indicated for almost anybody, but everybody's very different.
Of course.
Now, this really excels for those patients with acne scarring, enlarged pores, fine lines, and wrinkles.
Sure.
However, I've seen amazing correction in those just with blackheads and maybe random hormonal breakouts.
Yeah.
Or somebody with a little bit of facial redness.
Sure.
So really the benefits, I mean, amaze me even
Yeah.
sometimes.
Yeah.
So really, as long as we do that physical assessment, say for those patients with cystic acne,
Yeah.
I haven't really met many who aren't a candidate for treatment.
Oh, that's fantastic. And it sounds like people with rosacea too, with that redness might be a good candidate.
Just really depending on the type of rosacea
Yeah.
and if it's being managed with a dermatologist,
Sure.
there definitely is benefit there.
That's exciting.
Absolutely.
So you're coming in for your first treatment. What can you expect?
So, you know, this isn't a spa experience.
Right.
However, we really do a great job of creating a relaxing environment. Anytime there's needles involved, it's like, I know there's that little bit of shock.
Of course.
So, you know, everyone's different in terms of pain level. You know, I find it fairly minimal, but there are some, depending on the area of the face we're treating, it can be a little sensitive.
So are we talking like a 2 or like an 8 on the pain scale?
So it's hard to say. For me
Yeah.
personally, I think like a 4.
Who can't handle a 4?
Who
I
can
can
handle-
handle a 4.
But you know, some may say it's like a 5 or 6.
Sure.
This is why we numb every patient.
Yeah.
We use a fantastic numbing agent on the surface of the skin. It's just a topical,
Mm-hmm.
and we let that sit on the skin for 20 minutes, and it really makes the treatment so much more comfortable.
I bet. Now, how long is a treatment start to finish?
I would say, you know, we like to book an hour,
Mm-hmm.
just in case you need a little break, you need
Yeah.
a breather.
Yeah.
We always work in room for that.
Okay.
I would say the treatment itself, where the device is actually on your skin, 45 minutes.
Oh wow. So this is something that's relatively quick.
Absolutely.
That's fantastic. So you've had the procedure. What is the downtime like? What does that look like? Yeah.
Really, downtime is not as scary as you think. Again, and I can't say this enough, everybody is so different.
Sure.
Sensitivity level, age, lifestyle factors, really 1 to 3 days.
Okay.
Redness, maybe a sunburn sensation, that's the
Sure.
best thing I can equate it to, feeling like you got a lot of sun.
Yeah.
Little tenderness, swelling. I personally love the swelling because you look really plumped up and juicy, and who doesn't want that?
Everybody wants that.
Everybody wants that, especially if you have those little fine lines.
Yeah.
So I almost think that's an amazing after effect.
Yeah.
But the most you can expect is a little bit of redness, some tenderness.
And being in the summer right now, this is something where you should not go in the sun beforehand, correct?
Absolutely. You know, the sun really just undoes the effects of these fabulous treatments. You know, these are investments you're making in your skin, and the sun will undo everything like that.
Sure.
So preparing for your appointment, avoid the sun. Afterwards, avoid the sun. You don't have to live like a hermit.
Right, right.
But really be mindful. Let this be your kick in the tush for SPF.
Absolutely. All about that sunscreen.
All about that
so
SPF.
important, so important. Any side effects that people should be concerned about?
Not that I've seen. And this is why it's so important to know that your provider is performing these treatments regularly
Yeah.
and for a whole slew of skin types and conditions. That's why that initial assessment is so important.
So important,
to
absolutely.
avoid those possible adverse reactions.
So if you have a client coming in kind of curious about microneedling, what's the number one thing you tell them that will be a positive experience to come out of having microneedling done?
Just a fabulous tone. Your complexion really just becomes so much more revived after a microneedling treatment. Your tone, your fine lines and wrinkles, your hyperpigmentation. I mean, I'm still discovering how many conditions it actively corrects. So
Wow.
it is an amazing treatment.
That's fantastic, and I think we all deserve a little pampering
I
right
think
now,
you deserve it.
a little
I think
something,
you deserve it. We should,
right? I know. Let's make that happen.
We're gonna make
that happen.
Yeah.
Erin, thank you so much
My
for
pleasure.
spilling the tea with me today.
Yes.
It has been a pleasure. And
Cheers.
cheers, my friend. Have a great day.
Thanks, Instagram.